And I'm going to try to go through these questions. And Commissioner Varney, I think here's one for you. The question is, actually it's a twofold question, and I'll answer part of it and then let you answer the other part. What role does educating the public play in the state's efforts to reduce meth and prescription drug abuse? I'll answer the part on meth. As Tommy Farmer mentioned, we have a marketing campaign in place. It is trying to target those counties with the highest number of meth lab seizures and the highest number of children removed from meth homes. We have $200,000 in federal funds thanks to Bill Scollin's office. But I think, as Tommy mentioned, we actually need to bump that up a little bit to really saturate those counties. We really need to get it up to about $500,000 in order to effectively do that. And we're looking at possible sources of that additional funding. But with that, let me ask Commissioner Varney to come forward and talk about the prescription drug abuse education.
Thank you, Commissioner. Thank you, Commissioner. I think several people, and I stated in my own remarks earlier, I do think education and prevention is key to any kind of comprehensive strategy. We know it works. If you don't believe prevention works, look around this room. If this meeting had been 20 years ago, there would have been ashtrays around the table. This room would have been full of smoke, and the people who didn't smoke would be having trouble breathing. So we do know that you can educate people and that prevention does work. In our state, a lot of our alcohol and drug education and prevention, as well as treatment programs, are really funded a lot with federal funds, and the federal requirements require that 20% of our funding go into prevention and education activities. We actually spend about 23%, and we've gotten a few other grants that help foster that. One of the things I did want to say about education and prevention around that, though, that effort, you can have statewide kind of media things, and those are helpful, but real prevention and education has to occur at community levels. That's why we're really going to focus on these community coalitions, anti-drug coalitions. I think we've had a lot of experience to demonstrate that those are the kinds of strategies that really do work. So it is important. We are focusing on it, and it'll continue to be a main emphasis. Just stay right there. Okay.
The next question is yours too.
Okay.
And you kind of answered this earlier, but you might want to expand on it. Do you think drug courts will be helpful in lowering the recidivism rate while at the same time helping the community?
Yes, I'm glad people are asking that question, because we do hope over the next few years to be able to have to expand drug courts to where they're in every community in our state. We have them in the large metropolitan areas, and we have some really good examples to clearly demonstrate that drug courts do work. Now, what drug courts actually do, though, there's a lot of variation across the state. So what our efforts is going to be as part of the executive order and reassigning that is to looking at what are the practices that do work the most, sharing those practices among the various drug courts, and at the same time gathering data to help us make a case with the General Assembly for additional funding. One of the things that we do know that certain programs, whether it's drug courts or others, that would work in Memphis will not work in Kingsport, Tennessee. Or what will work in Chattanooga may not work in Knoxville. So we really got to tailor these kinds of efforts and the drug courts to a certain degree around what are their particular problems, what are the resources they have in their community. The real challenge for us, I mean, you can have, and we've got some great judges that have provided wonderful leadership for the drug court effort in our state, but they have to have resources, treatment resources to refer people to, whether it's a residential program like here in Davidson County that Judge Norman operates directly, or it's a community mental health center or an alcohol and drug agency. They have to have places to send people to help them change their lives. It'd be unconscionable really just to divert people without really giving options that will help them change their lives so they won't be back next month, right?
And I will direct this one to Commissioner Dreisner. What are some of the bright spots you see in Tennessee where we're seeing some success, and in particular, how do you feel the mandatory checking database puts us compared to other states?
So I would say, thanks for the question, whoever asked it. There are a lot of bright spots in Tennessee. The first part of the question, the mandatory checking, two other states that I'm aware of, Kentucky and New York, both have now similar laws. None of us have really good data on the effectiveness of that law, but inherently believe that it will help. I think one of the best pieces of news about that particular Prescription Safety Act is that the prescribing and dispensing community got behind us on that and supported it, and are stepping up and understand that they want to be a part of the solution. Because, make no mistake, that would have been a hard thing to do without the support of all the stakeholders. So I think that is definitely a bright spot, and I'm looking forward to seeing how that rolls out. We recognize that creates an additional burden on those communities, but we also recognize that it's critically important. Other bright spots, in addition to the subcabinets that we've mentioned, we also have a neonatal abstinence syndrome subcabinet that includes Commissioner Varney, Deputy Commissioner Gordon, TennCare, Human Services Commissioner Hatter, and Child Services Commissioner O'Day, as well as the Chief Medical Officer of TennCare, Dr. Wendy Long. Been working quietly for a number of months on a lot of different things. One of the things we recently were able to do is send a request to the Commissioner of the FDA to include a black box warning on narcotic analgesics to advise providers and people receiving those prescriptions that in doing so, if they're a woman of childbearing age, they were at risk for delivering a neonatal abstinence syndrome child. I think that's an important conversation starter. We do that with some other drugs. Accutane is a good example of drugs that have some particular risks for women of childbearing age. Obviously, one of the most important things we can do in that realm is to prevent unintended pregnancy. And by having that black box warning on there, I think that will assist with that conversation. That's going to be a long road, but I was really pleased that independently we didn't ask them to do this. The Tennessee Medical Association sent another letter to Commissioner Hamburg endorsing our request. There's a group called the Tennessee Council for Perinatal Care Improvement, TIPQC. I think I just butchered that acronym, but TIPQC, and Commissioner O'Day and I met with them about a month and a half ago around their efforts to address secondary and tertiary prevention, the idea of helping mothers during the period if they're using these drugs, and they may be using them legitimately for pain or legitimately for the treatment of addiction itself or illegitimately. But regardless, what are the things we can do to make it more likely that they will have a successful pregnancy outcome and less likely that they will deliver a NAS baby? And then what things can we do to improve the care of babies who are born with neonatal abstinence syndrome? Those are just a few that come quickly to mind, but you heard from Memphis, Shelby County. There are drug coalitions all around our state, people in their communities working hard on this problem to help prevent it. I'm very encouraged by what Commissioner Varney and his department are doing. It's terrific for us to collaborate with them. Our big piece of this really is the data. I obviously have a personal interest in this as well from my background, but we are the data gatherers, and another bright spot is being able to hire Dr. Klein to help us with our improving our data, improving the information that we're able to get, and providing good answers for decedents and their families. So a few bright spots, but I could go on, but I'll sit down now.
We just got two more questions for you, Commissioner Treisner. By the way, we have more questions than we have time to answer now. I guess that's a good problem. But going back to you, can there be penalties on physicians for not consulting the database or for prescribing if the database shows abuse?
Well, again, there's a Medical Practice Act in our state, and it details appropriate action with regard to this area. As you all know, it is not illegal for a doctor to write a prescription for a patient. It is not illegal for a pharmacist to dispense a medication. And one of the great challenges that we have, and you all have, is in showing when those actions constitute either negligence or malpractice or in fact a crime. And we have absolutely stepped up our efforts on the control side to make sure, and I think we have the strong backing of the provider and dispenser community to improve are disciplining of those professionals and are working where appropriate with other agencies to reduce the likelihood that those actions will continue. That was kind of an exclamation point there. So I think going forward, I'm very encouraged. We've just recently sent out, Mitch was at 40 letters to our top 40 prescribers looking at the database. Not all of those top 40 are doing anything wrong, but there may be some that are. In fact, we just disciplined one physician, I think who was number 3 on the database, one of the top number 3 prescriber, and disciplined, license revoked and put on probation for a good long time. So there are consequences for those few that have such a dramatic impact on the many, and we're going to continue to do all we can to make sure that the vast majority of clinicians who are doing the right thing, that have their heads down and have so much that they have to do in their 10 to 15 minute appointments, that they feel confident that their colleagues, just like them, are also doing the right thing. So,
Miss, we'll stand right there. I have one more. On that, I might add that under the Act, law enforcement can be given access to the database if there's ongoing investigation. Prior to the enactment of this Act, it was a little unclear as to whether federal law enforcement agencies could have access. We had clarified that, so federal law enforcement agencies are now clearly covered by the Act. One more question, Commissioner Dreisner, and I know you have an opinion on this. What is the primary reason that Tennessee, primarily Upper East Tennessee, has been hit so hard with prescription drug abuse?
that's so now I am speculating. I do not have science to back this up, but we saw in the early part, rather in the late 1990s, I think kind of a perfect storm. There was an important agency called the Joint Commission that accredits hospitals that made a accreditation rule that pain should be assessed and indeed would be treated as the 5th vital sign. Around the same time, some new and rather powerful medications were available on the market, a drug called OxyContin, which I'm sure many of you are familiar with. The manufacturer of that drug was subsequently convicted criminally in a court in a small town called Abingdon and fined $600 million for illegal activity marketing that drug to clinicians. But there was a strong marketing push by certain entities in the pharmaceutical industry. At the same time, there was a strong push in the professions to do a better job of treating pain. Remember, I said that 50% of the reason, half the reason that a new patient comes to a primary care physician is because something hurts. Think about your own life, and you'll see the truth in that statement. So there's an expectation, and in fact, a need to treat pain. And let me make sure I point that out. So these medications are powerful and beneficial, and we need them, but we don't need them for some of the things that they're being used for now, and we really have to get our arms around that. But I've said before, I think in many respects there was a perfect storm at that time. That came at a time when we knew less then than we know now about the treatment of chronic non-malignant pain. We know a lot more about that now, although our knowledge is still imperfect and we are still learning. And I think we probably treat some conditions, and some people will passionately disagree with me on this, so understand that this is one man's opinion. But we treat some conditions with opiates chronically that I don't think are really benefiting from that. Rule of thumb, if you're treating a condition, if the patient is doing better and they're functioning, going to work, going to school, taking care of their kids, that's a successful treatment. Function. If they're dysfunctional, if they're not going to school, if they're engaged in crime, if they're not taking care of their kids, if they're not working, that's dysfunctional. If you're treating pain in the setting of dysfunction and you're a clinician, that should be your indicator that you're not really treating pain. What you're doing is you're treating an addiction masquerading as pain. But again, that's a difficult area. But specifically why in that particular part of the world, when this all occurred, this is now a national epidemic. But Central Appalachia, which East Tennessee is a part of, areas in Utah and the Four Corners region of the United States and areas in the Northeast were the epicenter of that epidemic. If you think about an epidemic as an infectious disease model, you have to have an agent, something to transmit it, and a susceptible population. And those populations in those areas were particularly susceptible, I think, for a variety of cultural reasons. Often the example in the state of Utah is given that the particular predominant religious group abstains from other stimulating beverages, for example, like alcohol, but there's no specific prohibition about using a medication that you get from a doctor that comes in a bottle that you get from a pharmacy. So again, speculation, but I think a lot of people believe that that has a lot to do with why we are where we are today.
Okay, I know Commissioner Dreisner and Commissioner Varney need to get to another sub-cabinet meeting, but I have one more question for you, Commissioner Varney, and then Director Gwynn, if you would maybe answer this too. It's a hot potato that I'm going to throw at you. As we look at new tools to fight meth production, is the pseudoephedrine database being effective, or is there a need to require a prescription for pseudoephedrine products?
Go first. Or do you want to go first?
I think as we move further and get more of a definitive look at the database, the pseudoephedrine database, and is it effective or is it not effective, what we're seeing now is that probably it's not going to be as effective as we were hoping. So we must turn to some other type of alternative. When we look around the country and we look for best practices and things that have worked in other states, you have to look at Oregon, you have to look at Mississippi, at the fact that they scheduled and made pseudoephedrine a prescription-only drug, and their meth lab numbers decreased dramatically. So I think once we get a definitive answer on the fact that maybe the tracking system has not worked as effective as we need it to have worked, we'll look at that as a possible alternative to get our meth labs reduced.
I knew I shouldn't let him step in front of me. No, I'm just kidding. I agree pretty much with everything Director Gwynn said about that, but one of the things that government has to balance in its desire to keep all of us safe is how much intrusion do we want to put into private citizens' life or the practice of medicine or a whole bunch of other things that we feel that that a lot of people feel that the least government intrusion, the better. And I think just like Director Gwynn said, I think we're still hoping that voluntary or the reporting process will work. But we have looked at some of the issues around this, and incidentally, our department has responsibility for coming forward with scheduling and so forth. But we had a meeting actually at the TBI. I think Director Gwynn was there, and we talked to the federal folks who was there for the DEA and so forth, and I asked them a hard question: why don't you schedule it? If the feds would schedule it, then most states are like ours, as in Tennessee. We have a very small staff. I have my medical director, Dr. Burley, Jason Carter, one pharmacist that has to deal with scheduling. That they have a lot more resources and so forth, but they're not doing it for the same reason that we haven't done it in Tennessee at this point. Is the reaction that the public would have around that, the medical community. We want to make sure we've tried other options first. And again, we're hopeful that the database reporting will work. So far, it's not been that encouraging, but it's, what is it, a year and a half, Director? About a year and a half. About a year and a half it's been in place. So we're watching it very carefully because just as those slides in the story at Agent Farmer, I mean, it's pretty horrible what happens to people and everybody that's impacted around them. So this is on the watch list. This is on the governor's radar. He's paying attention to this, and I'm sure we'll act just as quickly as we feel that there's a clear course out there. Thank you.
Okay, Commissioner Varney and Dreisner, thank you very much. I have one for Chairman Trauber and Commissioner Schofield. Don't know if you know the answer to this or not, but where does Tennessee stand compared to other states in its recidivism rate? And do you think the governor's plan will have an impact on the number of repeat offenders? Who wants to go first on that?
Good afternoon. Wake up. Recidivism. States do not have the same methodology and method in computing it, so it's hard to compare. So that's the first part of the answer. The second part is that, yes, we believe that because we're selecting high-risk offenders, and that's high-risk offenders that not necessarily will do personal crimes or property crimes. They will do some type of behavior while they're under supervision. It could be technical violation that's non-criminal or criminal violations. It's those individuals who are fueling the repetitiveness of the criminal cycle and using the method that we've talked about in bringing people and resources together and anchoring that to the community with things like substance abuse, housing, education, and more accountability, and the partnerships between the state, the counties, Shelby County, and the city of Memphis in a reentry type program. We focus that on them. Then if we chose up to 60% to reduce that return rate, if we're fortunate enough to do half of that, that will really reduce the crimes in Memphis. One repeat offender, if they're on drugs, or if they're in a gang or something, or an organization do crime, one person can do 50, 60, 100 burglaries before they ever get caught. So just think if you can reduce them without coming back, in some areas you have really reduced the crime rate. That I'll turn over to Commissioner Schofield.
Just to add to will it work, yeah, we believe it will work. Part of that, what's happening is that we got to look at who we're incarcerating and how we incarcerate. Part of that seamless supervision model that we're going to really is designed to impact what happens on the front end. We want to reestablish and ensure that we got a good probation system where we can do supervision on the front end that really involves, having a swift, certain, and proportionate punishment. You put them out there, you want to be comfortable that we're going to do what we say we do when it comes to having folks on probation. If they violate, we're going to be there to make sure that we get them back in custody, we get them under supervision as quickly as possible. We cannot continue to build prisons and build our way out of this. So that's why we're working jointly with everybody to ensure that, we have that seamless supervision approach, that we're doing more than just incarcerating, but looking what's happening on the front end, adjusting what we do while they're incarcerated, and get them better prepared to come on the street for parole or eventually without being under supervision.
I've got another related question here for both of you, and I don't know if you have an answer to this. What percentage of what percentage, I think I'm reading this right, what percentage of non-gang related inmates are going into state custody and are gang related when they are released from state custody? In other words, they become gang members in prison, I guess.
That's one of those unscientific answers that you have to give. And, reasonably, we can assume that some of that happens, that they do become affiliated with gang members. We see a lot of that happening early on when we get our young offenders coming in. What we're going to do about that is that we're going to create programs that separate our younger offenders as they first come in. We're going to open up about 1,500 beds at the Bledsoe facility. Almost 300 of those beds are going to be for our youthful offenders. What we've learned from dealing with our staff and dealing with that population is that as they go out there, they're easily influenced. They're recruited by those gang members. So if we tackle that on the front end, we can kind of minimize that process and stay on track with those. There's no guarantees. The identification portion, give them in the right programming, give them something different, give alternatives. If we take control and not let the offenders take control, those gang members, we're in a better position to influence that process.
I'm not going to let him sit down. I keep getting questions on this. And you may not keep this data, I don't know. What is the 3-year recidivism rate for gang-related inmates as compared to the general population? And I don't know if you break that down or not.
We don't have it.
Okay, so the Department of Correction does not have that information. Let's see. Director Gwynn, I'll pose this to you. What are the top 3 challenges that you see in dealing with crime in rural areas versus urban areas?
I think all 3 would be related to bottom line resources. Your urban areas have a lot more resources than your rural areas. I look at the crimes that the TBI works. 20 years ago, we worked a lot of murders, especially in rural Tennessee. And we still work murders in rural Tennessee, but not near as much because law enforcement has become more sophisticated in those areas. But we're working a lot of computer-related crimes all over because rural law enforcement doesn't have the resources to work a lot of those crimes and the training is so expensive that they don't have the computer forensic experts like TBI has. So the biggest difference I see between urban areas and rural areas is the resources that are available. Your major metropolitan areas have a bigger budget. They will have specific units. They'll have a gang unit. Whereas I know in West Tennessee, with the help of General Woodall, we've stood up a gang task force, mainly having TBI agents as liaisons to travel around the rural areas and the rural law enforcement to gather their intelligence and information about gang members and to put it all together down there along with the Jackson and Madison County. So that's the biggest difference, is resources.
Okay, I've identified a few that I will actually try to answer. What can be done on the local level to help support the state initiatives to make Tennessee safer? Let me give you kind of a 3-part answer to that. First of all, if you look at the various action steps in the action plan, which you have in your packet, you'll see that there are opportunities there for local communities to work with state government on various things to make your community safer. An example is one that Bill Scollin talked about earlier. We actually have state funding available for local communities to establish family justice centers. And we're looking for that opportunity. I know we've had some representatives from Nashville here, Diane Lance, General Johnson, some YWCA representatives. We're already reaching out to Nashville, working with them to see if we can establish such a center here. But we would encourage any community to contact us. Is General York still here? I know the Cookeville area is interested. But that's an example. Really, it's not so much the local level supporting us, it's us trying to support the local level. The other thing is we will be going to the General Assembly from time to time asking for legislation to support implementation of this plan. We did that this year. We enacted the mandatory sentences for repeat domestic violence offenders, the gang legislation, the felons in possession legislation, the Prescription Drug Act, moving probation and parole over to the Department of Correction to have seamless supervision. All of those are things coming out of the plan. I will say that so far, in terms of legislative action, we're batting 1,000. Every single piece of legislation the governor has introduced to support this plan has been enacted. Hopefully we can continue that. But as we go forward, obviously we need you to be contacting legislators to support that. Third thing I'd mention is also kind of the reverse. One way you can support us is to look at creating your own plans in your own communities and then inviting us to the table to work with you on that and to see if we can provide state resources and input to help you implement your own local plan. I've got another one here that I'll answer. How are some of the recent efforts helping crack down on DUI offenses? Are they having an impact on highway fatalities. We kind of talked about that a little bit this morning. We didn't have time to address it in detail at this forum, maybe in a future venue. The good news is that traffic fatalities in Tennessee last year were the lowest since 1963. It was really a significant year in that respect. This year, it looks like we're going to be a little above last year. Maybe, knock on wood, maybe not. We'll still be below 1,000. It's close. I think it was 937 as of yesterday. It's going to be close. But while we're better than we were years ago in terms of traffic fatalities, we're not where we need to be. We're averaging, and Colonel Trott, correct me if I'm wrong, I think we're averaging 1.32 fatalities per 100 million miles traveled. Believe it or not, there are people who track the number of miles traveled in Tennessee. They really do that. So we're at 1.32 traffic fatalities per 100 million miles. The national average is 1.09. What? 1.9. 109. Okay, that's what I thought. We want to, our goal is to beat that national average. That's what we want to do. We know that driving under the influence is a contributing factor, and I pointed that out in the data this morning, that roughly a third of all of our traffic fatalities involve driving under the influence. We are really trying to focus our resources on tackling that problem. We're trying to be proactive on it. And what we're doing is data-driven deployment of our state troopers in order to deploy those state troopers in those areas with high traffic fatalities during the time of day when those traffic fatalities are occurring in order to have the maximum impact on that. Late one Friday afternoon, about a month ago, I was traveling from Nashville to Memphis, and I hit exit 108, Parker's Crossroads. Jimmy Eldridge, if he's still here, or Jerry Woodall, you know where that is. And between exit 108 on the interstate and the Madison County line, I saw 9 state troopers, all of whom had pulled someone over. And I called Colonel Trott and said, have you not told me what's going on here? Are we having some kind of problem here? And he said, well, it's data-driven deployment. We have found out that that part of I-40 has a very high fatality rate. And if you know that part of I-40, it's kind of surprising because it's very straight. And I don't know if it's because people just kind of doze off or what it is, but we've had a number of traffic fatalities involving multiple victims in that stretch of I-40. And what we were doing is deploying our resources on a Friday afternoon to try to address that problem. So it's an example of trying to use those resources in a data-driven way. We also are really trying to be proactive in terms of getting our troopers out there and really having an impact on the bottom line. I will tell you that for the first 2 years of this administration, our DUI arrests will have gone up almost 70% compared to the 2 previous years. And our seatbelt citations will have gone up almost 60% compared to the previous 2 years. So that's some examples of how we're trying to react to it. One more thing, the General Assembly passed a law this year. The DA's conference was very involved in this, which basically says that if a law enforcement officer has probable cause to believe that an individual is driving under the influence, that individual refuses a breathalyzer test, the law enforcement officer can seek a search warrant to draw that person's blood. That is a new tool in the toolbox for law enforcement. I think it can be a very effective tool, and one thing we have done working with local law enforcement across the state is during holiday periods in particular, is have a no refusal policy in place. And our position in the Highway Patrol, as well as the position of various local law enforcement agencies, is that if you refuse the test, we will seek a search warrant, period. And it's kind of interesting, and I don't have any scientific proof of this, but so far we've done that during the 4th of July holiday, Labor Day, Thanksgiving. We're going to do it again during Christmas and New Year's. And during that time period, in the counties where we had that policy in effect, I think, and Jennifer or someone can correct me if I'm wrong, but I think in those counties, during those 3 holidays, we only had 1 traffic fatality. We're trying to get the word out, not because we want to seek a bunch of search warrants to draw people's blood, but we want that policy to serve as a deterrent to people making the bad choice of driving under the influence. That's a long answer to the question, but I thought I ought to get all that in. Director Gwynn, here's one for you, I think. What are some of the long and short-term trends you see that we should focus on?
Well, I think we know that drugs, are the root of most crime and evil, as they say. And, we're trying to battle the prescription drug problem, and we've made some great strides in that. I think we're probably going to have to take a second look at the meth issue. One thing that concerns me, as I said before, is the heroin issue. I think we're going to see a proliferation of heroin in the state, and we're going to have to battle that. And as we did our presentation on the gangs, I think we've got to find a method by which we can get our arms around the gang activity in this state, while we can somehow contain it to certain areas right now. We don't, as the map showed, we don't have gangs in every county, and we know where the most urban areas of the state have the most gang activity. We got to try to get our arms around that. So the trends that I'm seeing are involving your gangs and your drugs, and trying to get, from a law enforcement perspective, our arms around those activities.
Okay, here's one for Chairman Trauber and Commissioner Schofield. Don't know if you know the answer to this, but what are the top crimes being committed by recidivist criminals?
Good afternoon again. Just want to make sure you're woke. In the returns to incarceration, 40% are non-criminal behavior, technical violators. 6% are dealing with crimes, either of a personal nature, that's violent crimes, societal crimes, which are burglaries and drug offenses, and other type of crimes. But as Dr. Karpos has mentioned to us, when we get to the personal crime, Judge Norman, that when they are finally released, that is it only 1 in 4 may return, as compared to property offenders and substance abuse offenders. That is the group that continue to raise the recidivism rate. That is the group that continue to raise the recidivism rate. And therefore, that's why efforts are being made to try to address substance abuse, and especially substance abuse when someone has a mental health issue also. Thank you.
Okay, I'm having to pick and choose here. I know we're running out of time. This is a very jurisdiction-specific question, but are there any steps being taken to establish a family safety center in Davidson County? I think I already answered that. The answer is yes. We've been working with Mayor Dean's office, General Johnson, and others to move forward on a family safety center here in Davidson County. Another question. I'll give an answer to this, but Director Gwynn probably wants to weigh in. And I think I know who asked this question. Strangulation is treated as aggravated assault as of July 1st. Would that help explain some of the increase in the major crimes category of aggravated assault? I'm going to give my opinion, and I don't know if General Wyrick is in the room right now. She and I have talked about this, and I asked her specifically in the significant increase in aggravated assaults in Shelby County, is it because strangulation is now being treated as aggravated assault? And she said no. we're not seeing any significant increase in our ag assaults due to strangulation. It may be a slight percentage of it, but it does not explain the significant increase in aggravated assault in that community, and my guess is that would be true in other communities as well. But Director Gwynn, do you have an opinion on that?
I agree. We're not seeing that as of yet, but, still early data.
One more for Commissioner Schofield, and then I think we're done. I keep asking you questions that I know you may not have the data to answer, but what is the bigger number? The number of offenders in state prison or the number of offenders in county jails?
I know some of you may argue, but the bigger number of those in state custody. I think for state offenders in our county jails, the total is about a little less than 10,000. In our state facilities, to include our private partners, it's about 19,900, something give or take. So that's it. That was a simple one. All right, thank you.
One last time, I see that we're people, when it's 2:30, they're ready to leave. Hispanic gangs were not mentioned in the gang presentation. What intel are we getting on the growth of Hispanic gangs, specifically MS-13? Director Quinn?
The gangs that were mentioned in the presentation are your gangs that have the most members. We get intel on a lot of Hispanic gangs, not only MS-13, but Brown Pride and so forth. Obviously, as the Hispanic population increases, your Hispanic gang population is going to increase. So yeah, we're seeing an increase, but no numbers close to being the numbers of the Crips and the Bloods and Gangster Disciples.
Okay, a couple of quick announcements. First of all, I am to announce that the police chiefs are to look for Maggie at the escalator going down. Also remember that we have literature on the credenzas out here. I urge you to take as much as you want. It does not do any good collecting dust on shelves here in the tower. Remember that the Governor's Newsroom website will have the presentations on there. Also, and I said this morning, but I want to reiterate it, this is our first time to do this. And we understand there are some lessons to learn. We know that there are ways to improve it, and we will be reaching out to you in the coming weeks and months to ask you your thoughts about this. How can we improve it? Because we want to make it better and better as we go forward. Again, thank all of you for being here. I know a number of you traveled hundreds of miles to be here. We hope this has been beneficial in terms of providing you a lot of important information for you to take back to your communities and giving you a feel for where we stand with the Governor's Public Safety Action Plan. My final message is we have a plan in place. All the departments of the executive branch are working together as a team. We're making progress on implementing that plan. We know we have a long way to go, and we also urge local communities to have their own plans, and we will be there to support you in that. Thank you very much for being here today.